All right, happy Monday again. So we are going to cover. I'm going to go back because chapter 4, 5, and 15. I didn't have videos for the lecture portion of those, so we're going to go back and take care of that. So the first chapter we're going to take a look at is chapter 4 for pharmacology. And this is your antibiotics and antifungals. So, bacteria are single celled organisms. Pathogenic bacteria are bacteria that cause harm. And infection is the tissue damage that is caused by either the presence of the bacteria or the toxins that they're releasing. So you can have different types of bacteria. So the two different types of bacteria are aerobic bacteria, meaning that they need oxygen to live or survive, and anaerobic bacteria mean that they can survive without oxygen. So there's three different shapes of the bacteria. If you reviewed your PowerPoint already, you've seen what those three different shapes are. There are two classifications of bacteria. So gram-positive, which means they have a thick cell wall, which will absorb crystal violet. So this is actually how they do the testing within the Petri dish to determine if they are gram-positive or gram-negative bacteria, is using that crystal violet. Gram-negative bacteria will have a thin cell wall, which will not absorb the crystal violet. Typically, symptoms of a bacterial infection is you'll end up getting a fever of greater than 101, and your white blood cell count will increase, and that's an indicator that your immune system is actually on the attack. Antibiotic treatment. So, antibiotic is a chemical substance with the ability to kill or inhibit microbial growth. It interferes with the biological processes that are inside the bacterial cells. So there's different factors to consider when a physician is determining what type of antibiotic that they want to use. Obviously, the first thing that they take into consideration is the type of pathogen. What type of bacteria is it? What is the antibiotic spectrum of activity? Does it cover both gram-negative and gram-positive, or is it just strictly a gram-positive or gram-negative bacteria? And we can use antibiotics that are specific in those two realms. And then the other option is the location of the bacteria. If we have a bacterial eye infection, we typically are not going to take a systemic medication. We're going to use bacterial eye drops. Identifying the bacteria and selecting the drug treatment. So a sample or swab is taken from the patient. So for example, if we suspect that the patient has strep throat, they're going to do the throat swab and have that tested. It's going to grow a sample within the laboratory, and they're going to check and see if in fact it is positive for strep, and then the course of treatment is determined from that. Nosocomial infections, this is really important. This is something that has led to drug-resistant or antibiotic-resistant bacteria. So nosocomial infections are infections that are acquired while either in a hospital or a nursing home or a long-term care facility. And these are often resistant to antibiotics, which in turn makes them very difficult to treat. Bactericidal agent is an antibiotic which kills the invading organism. A bacteriostatic agent is an antibiotic that inhibits the growth. So think about bactericidal, homicidal, okay, killing, right? So a bactericidal agent kills the invading organism, which a bacteriostatic agent will inhibit the growth, won't allow it to grow anymore. Evaluating the outcome of the antibiotic treatment is looking at the clinical response, and then looking at the microbiologic responses. Basically, is the bacteria responding to the antibiotic like we want it to. Side effects. So parenteral. Remember that your parenteral route is injectable route, so either an IV, an intramuscular injections, and those must be mixed exactly as directed. Orals, we want to make sure that we're swabbing our counting trays with alcohol, especially in between any dispensing of antibiotics. Gastrointestinal upset. So some of these antibiotics can upset the stomach, so they should be taken with food. Birth control pills. So if you have any patients that are on birth control pills, they need to speak with a pharmacist, and any appropriate auxiliary labels need to be placed on there, warning them that the antibiotics could decrease the effectiveness of their birth control while they're taking the antibiotic. Around the clock administration. So let's say a patient has a very, very bad infection, pneumonia, something like that could end up being life-threatening, sepsis. They're going to have around the clock IV administration of an antibiotic, and the reason for that is to keep a specific level of the antibiotic in the blood flowing throughout the body at all times. Antimicrobial resistance is a defense mechanism of the bacteria to become resistant or inactivate the antibiotic. It's important for patients to complete the course of antibiotic. This is huge. This is one thing that you need to take away from this, is that especially in a retail setting, we must ensure that the auxiliary labels are placed on all antibiotic prescriptions leaving the pharmacy. They can say things like, take all of this medication, finish all of this medication, and they're going to talk to the pharmacist, so the pharmacist can explain that even if you're feeling better in 2 days, your whole course of therapy is 3 days, 7 days, 14 days, 10 days. You need to finish the entire course of therapy, the whole entire bottle, because that's what's going to help decrease the prevalence of antibiotic resistance. So major classes of antibiotic drugs. I'm going to kind of skim through this pretty quickly. I want you to go back and look at these slides thoroughly on your own and see how they work, what they're used for. But sulfonamides and nitrofurantoins typically are used for UTIs. Nitrofurantoin is not well understood, but it works well for urinary tract infections. Sulfonamides do as well, but they can also be prescribed for other things like lower respiratory tract infections. Penicillins. So penicillins actually kill the bacteria by inhibiting the formation of their cell wall. So that's how penicillins are effective. The discovery of penicillin was actually the game changer for the health of not only the United States but the entire world when it was discovered. Penicillin can be used for anything from abscesses to meningitis, bacterial meningitis, sexually transmitted infections, otitis media, which is an ear infection, to pneumonia. So again, when you're thinking about the different antibiotic drug classes, look at the suffixes within their name. Your cillins, right, are going to all be penicillins within the penicillin family. So amoxicillin, ampicillin, piperacillin, tigeracillin, nafcillin, all of these, the very end of that suffix of that name is cillin. That is your first indicator of, oh, that's a penicillin. And 10%, up to 10% of patients in the U.S. do report a penicillin allergy. That's why it's important for us to get that history on it. We have seen that there is a small percentage of patients that report a penicillin allergy are also in fact allergic to cephalosporins, because those two families or classification of antibiotics are actually very similar. Cephalosporins kill the bacteria by also inhibiting the formation of their cell wall. We can use these for dental work, prophylaxis, use during surgery. So they will run a bag of a cephalosporin, just before you're going into surgery and then afterwards to prevent any opportunistic infections from happening. Skin infections, sinus infections, and also urinary tract infections. Your cephalosporins, they have the cepha in the name. So the prefix within the name. Penicillins is a suffix because it's at the end. Cillins is always at the end. In cephalosporins, that similarity of the drug names is in the prefix. So cepha. So CEF or CEPH. Okay, cephalexin, cefaclor, cefdinir, cefoxetine, That's cepha, okay? So that's your indication that, oh, these are cephalosporin drugs. Carbapenems, they also kill the bacteria by inhibiting the formation of their cell wall. In that TED Talk you watched, I hope it was very informative. I watched the whole thing all the way through, and found it was a pretty actually fantastic TED Talk. It covered a wide range of how and why we got to where we're at and all of that. But the carbapenems have always been kind of our strongest line of defense for bacterial infections. And now we're seeing an increased incidence of bacteria being resistant to those, which is starting to cause a lot of problems. MRSA. So vancomycin is actually a medication that's actually not fully understood as well, but they think that it inhibits the cell wall formation of the bacteria. We use vancomycin in our very stubborn or very severe infections like MRSA, which is a resistant infection, endocarditis, which is a infection around the sac of the heart, and then C. diff. So when you begin working in a hospital, if you choose to go into a hospital, you will learn very quickly what C. diff is. It has a very distinct smell. This bacteria causes severe diarrhea in our patients. It's highly contagious, and that diarrhea actually has a very distinctive smell. So vancomycin, I'd pay attention to this because this is going to help you on one of your questions. So typically vancomycin has to be diluted in at least 200 to 250 mLs of a diluent or a larger amount of fluid, and be given very slowly to our patients via IV to prevent red man syndrome. If you go back and look at your Chapter 4 PowerPoint and head to slide 17, you'll actually see what that looks like on a patient. Lincosamides and macrolides. So these work by blocking the bacterial ability to produce the needed proteins for survival. So these particular bacteria need to produce their own proteins to continue the survival, and these two antibiotic classes prevent the bacteria from being able to do that. We use lincosamides for things like acne, bone and bowel infections, intra-abdominal infections. We use macrolides for things like chlamydia, Legionnaire's disease, and different types of pneumonia. Your lincosamide would be clindamycin, okay? And then macrolides would be things like azithromycin, clarithromycin, erythromycin, and these all kind of fall within the same category. The azithromycin, which we call Z-Pak, that's the most common name you're going to hear it. That's kind of the go-to for all respiratory infections that are bacterial. So a little tip here for technicians. So the Z-Pak is an example of a drug that is dispensed in a dose pack, but it can also be dispensed in a bottle. So what we want to make sure that we do is that we have the correct instructions on the bottle for the patient. So the Z-Pak comes in either 250 milligram or 500 milligram tablets, and whatever the instructions are going to either be placed on that already prepackaged dose pack or on the bottle if we're dispensing them as single tablets. Aminoglycosides kill the bacteria by blocking their ability to make the essential proteins for survival. So they work very similar to the lincosamides and the macrolides. Again, they prevent the bacteria from producing that particular protein that they need to survive. We use these things for typically gram-negative bacteria, so things that are causing severe infections for like sepsis or peritonitis. Tetracyclines. Tetracyclines inhibit protein synthesis within the bacterial cell walls. It's a common use for anthrax, acne, chronic bronchitis, chlamydia, One important thing about the tetracyclines is it may be taken with food, but you want to avoid dairy products because it can inhibit the level of absorption of the drug. Fluoroquinolones or quinolones, okay? Actually, let's go back to tetracyclines. I want to talk about the suffix in the name. So when you look at doxycycline, tetracycline, minocycline, cycline, right, is that suffix of the last of the name. That should be your indicator that it's belonging to the tetracycline family. Fluoroquinolones or quinolones, they inhibit the enzyme that helps the DNA to coil, which helps in replication. We use this for bone infections, serious urinary tract infections. Cipro is actually the go-to, kind of the preferred treatment for anthrax. When you look at the names of these drugs, the suffix should indicate that these are quinolones or fluoroquinolone drugs that belong in this family, and that's fluoxetine, ciprofloxacin, levofloxacin, moxifloxacin. The fluoxetine ending point of those drug names should be your indication that those are quinolones, quinolone antibiotics. Metronidazole is in a category all on its own. Flagyl is the brand name. We use it to treat amoebic dysentery. We can use it to treat C. diff, H. pylori infections, trichomonas. There's a lot of different side effects from this, but the most important thing, this medication, Flagyl is the brand name, metronidazole is the generic name. This medication, if you're dispensing it from a retail pharmacy, will always get a do not drink alcohol auxiliary label on this medication. It is imperative. It's very dangerous side effects if the patient is taking this antibiotic and drinks alcohol while taking it. Linezolid is another one that's in its own family. Zyvox is the brand name. It inhibits bacterial protein synthesis. We use these for resistant drug or bacteria, so MRSA, VRE, which is vancomycin resistant, and then other severe gram-positive infections. Daptomycin, this is the one that I've talked to you guys about when we've done our sterile products course, and we talked about certain drugs that we can reconstitute in a vial and kind of shake it up and help it. This one is one of those that you cannot. You have to very slowly add your diluent and then just let it sit and dissolve on its own. If you kind of shake it up, roll it, even any of that kind of aggravation to it, it will foam and it will never go into solution and you won't be able to use that vial. So daptomycin inhibits inhibition of DNA and RNA synthesis within the bacteria itself. We use these for complicated skin infections like staph, complicated topical or skin staph infections, and then also staph infections of the blood. So they've got a staph infection that is in the blood and is circulating systemically throughout their body. So storage requirements. Some antibiotics require refrigeration. In fact, a good majority of them do. But some antibiotics may be stored at room temperature. It is appropriate for pharmacy technicians to discuss this with patients. It is not that clinical side of counseling. We can tell them how to store it, especially here in southern Arizona. If it's the middle of July and they're coming to pick up an antibiotic suspension that needs to be refrigerated, we need to let them know so they're not leaving it in a hot car and stopping and making other stops along the way home. Medication flavors. Most pharmacies have the ability and give the option to patients to add or change flavors, especially with pediatric patients, because that helps the patients become compliant. It'll help our parents be able to give these already nasty tasting antibiotics to their children. So ophthalmic antibiotics, they have special manufacturing requirements related to pH and sterility. A lot of you missed this question. I know this is also covered in chapter 15 specifically for the eyes, but one thing I wanted to discuss is that we can always use eye drops in the ears, but we can never, ever, ever use eardrops in the eye. And the reason for that is the ears are not considered a sterile environment, and the eardrops are made according to that. We cannot place those into our eyes because they are not made under the same sterility conditions. They do not have the same required pH balances within those drugs. So it can cause damage to the eyes and be very serious complications from that. So most eye antibiotics are expensive. A lot of times they are rejected by the insurance companies. You want to inform the prescriber regarding medications that the insurance will likely cover. So there's kind of a very few range of ophthalmic antibiotics that most insurance companies will cover, and that's because of them being already generic and cheaper versions. So if the physician has ordered something that can be replaced by a cheaper substitution of a generic, then the pharmacist should attempt that for the patients. Sexually transmitted infections, so genital system infections that are transmitted via sexual activity, formerly known as venereal diseases. First line of prevention is obviously abstinence, being in long-term monogamous relationships with an unaffected partner, using condoms, okay? So chlamydia is caused by the chlamydia trachomatis, which is often asymptomatic. Typically, chlamydia occurs frequently with gonorrhea, so usually those kind of two go hand in hand. If it's not treated, so let's say one partner gets treated and the other one doesn't, there is that risk for reinfection. Gonorrhea is also caused by a bacteria, so in males it can cause painful urination and discharge of pus. Females can get an abdominal pain due to pelvic inflammatory disease. Long-term complications of not treating gonorrhea include sterility for both female and male patients. Eventually, untreated infections will lead to a systemic infection, which means it has traveled from the genital area and moved into the bloodstream, and then it can affect your heart, your eyes, and other parts of your body. Females who are pregnant, when you go in for your first kind of few appointments, they will actually test for gonorrhea. And the reason for that is if a female gives birth and they have a gonorrhea infection, if they deliver the baby vaginally, they run a high risk of the baby getting the bacteria in their eyes and causing blindness. Syphilis is in a bunch of different stages. It's caused by a bacteria. So the first or primary stage, you can see a canker, sore type thing at the site of infection, which typically heals in weeks. The fluid from these canker sores is highly infectious, and that's what kind of transmits that. And the bacteria can enter the bloodstream. Your secondary stage, if it's not treated, it'll move into the secondary stage. You can get skin rash, patchy hair loss, mild fever. The lesions are highly infectious. The symptoms do subside, and the disease ends up becoming latent, which means you have it, but it's not fully active if it's not treated, and then eventually it will go into the late or tertiary stage. This is basically after 10 years of not treating the infection. You can end up getting rubbery tissue masses on your organs or your skin. You can get deafness, blindness, and a perforation of the roof of the mouth may occur. So the congenital syphilis is when you have a pregnancy in a patient that has not been treated for syphilis, and they have syphilis and they are in the third or tertiary stage, the late stage. They can have a baby that is going to be exposed to that bacteria, which can cause neurologic damage. If the pregnancy occurs in the first or second primary or secondary stages of syphilis, those births actually usually end up resulting in a stillbirth where the baby dies before it is born. Different types of infections going on, vaginitis. These things are able to be not only transmitted via sexual contact, but for non-gonococcal urethritis is actually caused by catheters. So if someone is self-catheterizing themselves to empty their bladder, typically patients that are paralyzed from the waist down, that's how they use the restroom. They catheterize themselves every so many hours to empty their bladder. Because we keep reintroducing a tube into the urethra, into the bladder to drain it, there's always that risk of introducing the bacteria. There's different agents that we use, typically specific drugs from every drug classification of antibiotics that we use to treat sexually transmitted infections. So fungal and fungal diseases. So fungus is a single-celled organism. These things include mushrooms, yeast, and molds. They differ from green plants because they lack chlorophyll. The chlorophyll is what makes green plants green. And fungi actually reproduce by spores. So here in southern Arizona, we have something called valley fever. Valley fever is actually a fungal infection, and it's spread through the spores in the dirt. So when we have, really windy days, or we have massive monsoon storms come in, and we have a really high wind pickup, and everything's really dusty, the spores of the valley fever are actually in that dirt. Dogs are actually the most common animal here in southern Arizona that gets valley fever because they're outside, they're digging in the dirt, and then they're inhaling the dust with the spores. Fungus differ from animal cells and bacterial cells because they actually have a rigid cell wall. They differ from human cells because human cells contain cholesterol, and fungi cells contain ergosterol. So that's the difference between fungi and human cells. So fungal diseases, mild topical ones. So we're looking at vaginal yeast infections, athlete's foot, ringworm. Yes, ringworm is a fungal infection and not a parasite. Serious systemic infections typically are immunocompromised or at higher risk for these. And these, systemic fungal infections can be very dangerous. We have different types of antifungal medications. So amphotericin B works really well. It's only available in an IV form, and they only use it to treat very life-threatening fungal infections. Your azoles. So again, there's that suffix, right? Fluconazole, itraconazole, ketoconazole, your azoles, okay? These are used, they inhibit the formation of the cell wall of the fungus, and we use these things for vaginal fungal infections, skin fungal infections, nail fungal infections, which is very common if you go to a nail salon, because if they're not cleaning and doing all of their proper procedures for sanitizing and sterilizing their equipment, you can get some nasty nail fungal infections. So again, remember for your azoles, okay, use these suffixes and prefixes of these words, of these drugs, to help you remember what drug classification they belong to. Let's see. Caspofungin and micafungin are two drugs that are antifungal medications. They inhibit the synthesis of D-glucan, which is actually an integral part of the fungal cell wall. So that piece of the cell wall that's not able to fully develop or re-replicate is how these two drugs work to kill that fungal infection. There's different miscellaneous, griseofulvin, cyclopyrox. The cyclopyrox which is known as Loprox or Penlac, is actually a very common one that they compound into a nail polish. It's a clear nail polish with the medication in it that allows the patient to just paint that onto their nail, and the medication absorbs into the nail and will get rid of the fungal infection. So we're almost to the end here, guys. Echinacea, we talked about this a lot in our natural supplements section, especially within chemistry. So echinacea is used to treat the common cold, and it also has been used for centuries to help increase or boost a patient or person's immune system. It can reduce the severity and length of symptoms. Variable concentrations are available out on the market. Again, that's why it's important to make sure you go with a USP verified brand. There's no standard dose available, so there's nothing that says taking 100 milligrams of echinacea a day is what helps boost your immune system. Most of these things have just kind of been passed on through generations, through different cultures, and because they are not regulated by the FDA, no true scientific research has been done around most of these natural supplements. What has been found is that echinacea should be used multiple times a day and started at the very first signs of an infection. And then zinc, one thing they've been actually talking about lately, because you see a lot of different social media posts and news reports about people taking or increasing their vitamin intake, vitamin C intake, and zinc is one of those. Because it helps enhance wound healing. It helps prevent wound associated infections. So if you have a cut or a scrape, increasing your zinc intake has shown to help with that. But again, no well-established dose. No research has been in to say if you specifically take 20 milligrams, it's going to do its job. There's nothing and no research out there to say that. So we have finished up all of chapter 4. The assignment that you have for today, you're going to want to use your book. You're going to want to use this lecture. You're going to want to use your PowerPoint. And it's got some math in it. I try to mix it up a little bit, but it is specific to chapter 4. As always, if you have questions, make sure that you email me, and I will see you on the next video.